Hello, everyone, and welcome back to class. So, this week we're looking at a topic related to research design that probably has maybe just a minimal impact upon what you will be doing, but there could be some valuable use for case reports or case series, and hopefully I can illustrate to you what those are for your dissertation. And I just also want to highlight too that you're going to be on the front lines of whatever specialty you're working in, and there may be opportunities for you to write a case report or to write a case series. And that information that you provide could have a positive, or maybe positive isn't the right word, but a valuable impact upon others in your profession. So we've been looking at a variety of things, and we've spent time looking at the experimental side and the observational epi. And now we're taking a look under the descriptive epi a little bit more. We did talk about descriptive epi, but now we're focusing a little bit more just on case report, not necessarily epidemiology per se, but case reports in and of themselves and what they are. So why this presentation? Well, because you can contribute to your profession's knowledge base and or potentially influence future research. So you are positioned to help change practice. And case reports may be valuable information in the introduction section of your dissertation. Why? Well, they might provide historical context for your introduction section. For example, this, and I think I shared this one previously when we talked about epidemiology, this was a case series presenting a rare form of pneumonia that was seen in a population back in 1981, and it was an opportunity for physicians to describe this presentation. And later, it would go on to be obviously better known as HIV. And so, again, 1981, a whole different world when it came to sharing of information and information getting published in journals, and there wasn't an online way of sharing information, etc., etc. So this was a main way of getting information out there. And so this particular sample was of 4 men. I know some of you have interests in rural health. Now, I didn't do a deep dive. I pulled the first article I could find here. Obviously, it's from Australia, but if you were doing something rural health wise, finding a case study may provide, again, that historical context. It may give the background as to why future studies were done and the ultimate reason for your particular research question. Also, case reports could be valuable potentially in your discussion section. So if you were looking at prescribing or recommending somebody to use a supplement, and let's say that supplement had good benefits for a particular condition, what are the potential side effects? Well, this one appears to be a rare side effect here, but it was one published looking at liver danger with that herbal product. So what you might write in the discussion section is, let's say you found that the supplement was beneficial through the different studies you investigated. It would be important, I think, to highlight to potential referral sources like yourselves that there are potential side effects, and that could be of importance for your patients. So what are case reports? Again, those are these stories about our patients. There's stories about the medical and healthcare services that we provide, and there's stories about real clinical, real practice situations. And the reason I say real is because sometimes there is an argument that's made between, hey, you did something in the research lab, but that's not how the real world works. And so, is there that ability to translate things? And we see this in physical therapy, and I'm sure there's examples within medicine too, where maybe we do something in the biomechanics lab, or we're using other types of equipment that just isn't readily available in the clinic. Well, how do you translate that? Well, case reports are nice because they are presenting those real clinical and real practice situations. And again, this one being one of those real clinical, real practice situations that was observed. Here's another one. Let's say you work in orthopedics. This is an example of some sort of abnormal formation that's occurring after a particular total wrist arthroplasty procedure. So case reports, and I'm not going to read through these here, I'm going to go over to this page. They model evidence-based practice. Now, they are the lowest level of evidence, so that is at that level 5, but they are modeling evidence-based practice. It is usually illustrating something that is drawing from things that we already do. It is the application of treatments that we do, the application of testing procedures that we do. So there is evidence behind it. It's not just making stuff up, but it's not research either. And so we don't know if it's something that can be generalizable to all populations. What it does is it can suggest hypotheses for future research and potentially persuade or motivate other practitioners to consider that form of treatment. And these things are great too because they provide material for teaching and learning. So if we go back to here, if you're working in orthopedics, maybe this is something you weren't familiar with regarding this particular procedure, and so it's something to be aware of. Maybe the risk of it is extremely low, but it helps to provide education, to make you aware of possibilities. And then obviously it helps to convey experiences to other clinicians. So case reports highlight unique clinical problems or challenges. For example, neck-tongue syndrome. I'm still not sure if I know what that is. Have you heard of that? It's obviously a unique clinical situation. They highlight common problems or challenges not addressed in other forms of the literature. They can illustrate differential diagnoses, so they can serve that role of educating people. So, for example, in this particular case report that I wrote here with 2 other individuals, it was, I think, a beneficial thing for physical therapists because it detailed some of the testing that a hematologist would perform to be able to identify an athlete who was iron deficient with anemia. Other things they highlight include processes for decision making, community interventions, and ethical dilemmas. Now, case reports again are represented here, where at baseline there is treatment, or baseline there is diagnosis. There is basically a patient or maybe 2 patients that you're working with, and you work with them or observe them over a period of time. You collect information about them, and then you think, oh, well, that would be an interesting thing to write up. You go back in time to review the case information and write up a case report. So it's basically like storytelling. What they're not is they're not these single subject designs. And we looked at those earlier in the term, single subject designs being something that has an intervention to it that requires IRB approval. And you're looking to see if that intervention makes a change from the stability of their presentation. So again, a case report here, one that I wrote up, basically this case report was looking at a rehabilitation program For what was unique in this case is wrestling was not common at the Division III level. So this was wrestling for female athletes was not common at the Division III level. So this was basically the application of a rehab program for a female wrestling athlete in order to help her return back to sport at the end of the season. The single subject design over here, that being different, because remember we've got a set of measures. We're looking to make sure the behavior stays the same. There then is the B phase, which is where treatment occurs. We see a change, then we remove that treatment, and we see a return to the baseline. So this is experimental. Now, let's talk about a case series. A case series is usually defined as a collection of case reports. So that makes sense. But I also want to highlight that sometimes, and you need to look at the article closely, a case series, is it a case series or is it something else? So as I said before, a case report, that makes pretty good sense because you're looking at one person and you're making a report about it. But when does something become a case series? And there isn't necessarily a clear-cut answer to that. Is 2 cases also a case report, or is it now a case series? Here is something that could be argued to be a case series. It was titled 2 Case Reports. And for the treatment of anterior knee pain or patellofemoral pain syndrome, which is pain around the kneecap area, historically, 25 some years ago, people just really focused upon strengthening the quadriceps. And what this group did is they did a little bit more of an emphasis on strengthening the hips. The hips have an important role with maintaining optimal or ideal lower extremity kind of anatomical relationship. And so what they found was targeting the core, targeting the hips, strengthening those, in addition to the quads, helped these 2 people improve. Can you generalize that to more people? No, but it suggests something that should be studied, and a lot of people went on to study that. And a systematic review in 2018 found that hip and knee strengthening is effective and superior to knee strengthening alone. So this particular case report, or 2 case reports, or you could call it a case series, was very influential in the physical therapy orthopedic world. Here is a study described as a case series where they were looking at MRSA in high school wrestling team and the surrounding community. Here was something listed as a case report, but also as a case series. Now, they included 3 different individuals in this. So they found 3 people through their time working as physicians that had this unique C2, C3 cervical presentation, kind of a fusion in that area. Here they called this a case report. There were Jones fractures, 3 case reports instead of a case series. So what I'm trying to get across is sometimes, does it really matter what it's called? Basically, a case series is several case reports, and sometimes people just call them case reports. What I want you to be aware of is something like this, where the article is titled as a case series. So a case series evaluating patient perceptions after switching from, I'm not even going to try to pronounce the names because I'm not familiar with them. I'm assuming they're both medications for spinal muscular atrophy. But as you notice here, an IRB approval was required. Typically, for a case report or a case series, IRB approval is not necessary. Why? Because you're not doing anything experimental. That example of the physical therapy intervention where they included strengthening for the hip muscles, that's not anything unique. That's just doing additional strengthening. Had they decided to utilize dry needling, that might be considered unique. But you could also argue that, dry needling is common practice in most states in the United States. And so you could potentially get away without doing it. What this particular study is doing is a change apparently in this medication. And so obviously that is something different that warrants making sure that it's safe for the patient. On top of that, it's called a case series, but there were 14 participants in this. 8 of them adults, 6 of them were children. So typically, is an IRB required for a case report or for a case series? And the answer is typically no. However, I did find something, and I think some IRBs may be more conservative. For example, the Oregon State University IRB, they note that when a case series has information on potentially more than 3 patients, that case series is now considered to be a systematic investigation designed to contribute to generalizable knowledge. So in other words, it's research, and therefore it needs to go through their IRB. So with like this study here, it's almost like it is a single group pre-test, post-test design. And we talked about those previously. Obviously, those lack control groups, but they're looking to see if a particular intervention or something like that is effective. Long story short, is there a magical number for when something is a case series or it converts to something else? There really isn't, but somebody may need to check with their particular institution's IRB to double check. Typically, case reports and case series do not require IRB intervention. Something requires IRB intervention if you are doing something that is experimental in nature. So what are the strengths of case reports? Well, there is a depth of detail, a richness of information. They focus on individual differences of our patients. They highlight unusual successes or failures, and they present individualized interventions and services. But we must keep in mind, though, that these are level 5 evidence. Now, this is a slide that I share with my PT students, but the same thing could apply to you. Why should you write a case report if given the opportunity? Well, it gives you the opportunity to share ideas. You learn from the process because you learn more about the topic because usually you are trying to cite literature either related to what is typically done for that patient or literature that supports the unique application, the non-experimental unique application. Can be used to promote your profession. And so I know some physical therapists, when they will publish a case report, they will use that to market, help to promote themselves, help to promote their clinic. And it's also something you can add to your professional resume. So whether your future is working in an academic environment or if your future is trying to work with a different professional group, that may be something that's attractive to a future employer. Now, reasons not to write or not to publish a case report. So that's kind of a weird reasons not to do it. Okay, basically these are the things that people some might feel like, oh, I can't write a case report, and these are my reasons. And I'm trying to say these are not reasons to do that. For example, not having any time. In reality, nobody has time to do anything. So if it's something that's important to you, try to find and make that time. I've heard from people, they say things like real clinicians treat patients, and that's just an absurdity. Probably hear that more from like the physical therapists, some of the ones that feel like their stuff doesn't stink. Um, this one here maybe is a legit fear. Editors and reviewers are heartless, but I think the reality is when you go through a peer reviewed process, people understand where case reports and case series fit in the grand scheme of things. And so, as long as somebody is not trying to take too giant a leap as to what the meaning of the case report is, they're not going to be as aggressive with their critiques. Sometimes people will complain about, it takes forever to get published. And in reality, and in the modern day, especially if you go with an open access journal, they're getting published immediately. And even if you're going with a traditional journal, oftentimes they publish ahead of print. There's always a fear of putting your foot out there and thinking that colleagues might be critical, or others in your peer might be critical, or others in your profession might be critical of you. And if anything, that's just professional jealousy on their part. Don't write well. People sometimes have that concern, and that's something we're going to continue to work on throughout the series of courses here. Scientific writing is hard, but trust me, some of the top writers in my field have challenges. I have been fortunate to get to work on a couple book projects, and some of the top writers, or not, I shouldn't say top writers, some of the top researchers in my field have contributed to those books, and some of their initial submissions would show that everybody has, for lack of a better word, everybody has challenges. And I would argue too that I have challenges at times too. Sometimes I feel like I nail it, and other times I get things back and it's like, wow, that was really lousy how I wrote that. So people, it's a challenge. It takes time. The next one, no one would be interested in your topic. Well, I don't think that's true, because if it was interesting to you, I'm sure there's other people that it'd be interesting for. And the last one there, you won't get paid for doing it. And that's true, you won't get paid, but um, it's always kind of exciting when people cite your work, when they refer to it in different conferences and so forth. And so you may not get financially paid for writing and publishing something, but it will have positive implications for your professional career. And a lot of these things here, I'm talking about case reports. And again, I would encourage you all, the same thing kind of applies to when you get done with your dissertation. I would encourage you all, as you work with your dissertation committee, to think about a journal to submit to. And if it gets rejected from there, don't give up. That's all part of the process. You can find a home for it. Because again, if it's something you're really passionate about and it's really interesting to you, I guarantee you that there are other people that will have an interest in that too. So what does a case report look like? It basically looks a lot like any other research type of study, any type of peer-reviewed publication. There's an abstract at the beginning, you have an introduction and background section, and then you describe your patients or your clients, and you may have just one person, or you may present them as the two or three different individuals. Describe what your examination process was, how the diagnosis and prognosis were established, any interventions that were used, any reexamination and outcomes from the interventions, and wrap things up with a discussion and a conclusion. All right, so that's been an overview of case reports and case series. Hopefully that was of interest to you. And again, I think the main thing, I think one of the most important things here is, as you are working on your dissertation, Case reports and case series may be, I say may be, of value to show historical context within the introduction section, and they may be of value to illustrate kind of unique patient things that are of consideration that a provider should be concerned about, something you would highlight in your discussion section. All right, take care.